During the next hour and a half, Lynn Lebeau, along with Sean Curtis, our Director of Product Marketing, will be hosting our panel discussion, and we hope that you'll be able to relate and learn from the panelists' day-to-day experiences and long-term results. It is my pleasure to introduce today's panel members. The first with Maggie Penna from Doctors at Renaissance, Leslie Kaminsky from Fraser Health, Jamie Hulslander from HCA North Texas, Jason Youngbar from Shore Health, Carolyn Cyrus from Centura Health, and Susan Lebeau from Beverly Hospital. We are also joined by Formfast expert Scott Steflevak. I apologize, Scott, if I mispronounced your name there. Our OEM business manager, Ken Ham, who is our senior systems consultant, and we're going to welcome back Clara Anderson, our design consultant supervisor. Lynn, at this time, I'm going to let you start out with the first set of questions.
Okay. I thought we'd go, I think we're waiting for a few panelists to join right now to get their phone lines connected. But I do believe Jason is connected. So I'd like to, Jason, can we start with you? And if you can just give your name and your job title and tell us about your facility and how long you've been using Formfast and what applications you have in use.
Okay. Good afternoon, everybody. My name is Jason Youngbar. I'm the Senior Integrations Programmer for Shore Health System, which is a 2-hospital facility that is now part of the University of Maryland Medical Systems. We've been basically a Formfast vendor for the last 7 years. We first implemented Formfast on an HBOC platform, McKesson HBOC platform, and about a year after the initial implementation, moved over to a Meditech client server shop, which we've been on for about the past 6 years, a Meditech client server facility.
Great, thanks, Jason. So I'm going to move over to Maggie Pena from Doctors at Renaissance. Can you just give us a little outline of the Doctors, the mission at Doctors, the size of the facility, and what you're using Formfast for?
Sure. Hi, my name is Maggie Pena, and I'm a financial system analyst, and I am the one in charge of implementing Formfast. We started implementation back in November 2009. We're not fully completely implemented. I know we are using FastPrint, we're using FormImprint in some of the facilities. We have several facilities. We're a 400-plus bed hospital. We are using the FastFlow already for the rack audit. And right now I'm in the process of finishing up the FormImprint for the facilities. Like I said, we have our acute hospital, and we have a women's hospital, we have a cancer center, a behavioral center, and a rehab center. So I'm taking it a facility at a time.
Great, thanks, Maggie. Leslie, we'd like to hear a little bit from you now.
All right, my name is Leslie Kaminsky. I'm the coordinator of the electronic health record for Fraser Health Authority. We're located here in British Columbia, Canada, and Fraser Health Authority is comprised of 14 acute care facilities, and that includes a number of residential facilities, community facilities, public health, all of the services associated with those 14 acute hospitals. Now, we're organized in 3 service delivery areas, and to just give you a sense of the scope of our implementation, we've got 5 facilities that fall in the under 100 acute care beds. We've got 5 facilities in the range of 100 to 200 acute beds, and then 4 facilities that are over 200 beds, and a couple of them up around the 500 level. So we've got a total of 2,500 acute care beds across 14 facilities. We are live since 2007 with FormImprint, and that's predominantly the application that we're using. We're live in 7, just trying to remember exactly. We're live, in 9 of our 14 acute sites now, and we'll continue to roll out to the remaining 5 sites once we convert them to client server. We're client server based in those 9 facilities, and as we convert the rest to client server, then we'll implement FormImprint there. We do use a few of the admission fast form forms, but predominantly this application is form imprint in this health authority.
Great, thanks, Leslie. Carolyn Cyrus from Central Health. Can you introduce yourself and tell us how long you've been using Formfast, a little bit about your facilities, location, and your role in your organization?
Sure. My name is Carolyn Cyrus, and I'm a systems analyst at Central Health. We're located in Lynchburg, Virginia. We do have multiple facilities and also physician offices throughout the locality here. My primary role in MIS or IS is McKesson Start system support, as well as the Formfast automated forms. We went live with Formfast in 2005. Of course, before then, we only had the paper forms. When we went live, it was part of the McKesson project because we came up on with a lot of different McKesson applications at that time, and Formfast was kind of an add-on as it was a partner with McKesson. Originally, we went live with the Forms on Demand, which is a form imprint, and some automated admission forms, and since then we've implemented the e-signature, and we've also automated some of the clinical forms as well as the patient receipts.
Carolyn, thank you. We're going to go around the table now again and just kind of ask this combo question. If you can kind of describe the typical forms workflow before Formfast, and then how has your workflow changed since implementing Formfast? And Maggie, can we start with you?
Sure. Well, I guess I can pretty much describe the admissions process. Is that okay? Would that be?
Yep, you bet. That's perfect. Thank you.
Okay. You know, typical admissions. Well, actually, the way they would do it here is they would have already packets ready, which in a way it was a little bit easier for them. You know, packets were ready, and all they had to do was give the patient and sign, and then put on the sticky label. Well, I mean, at first we did have a few people saying, well, this is going to take a lot longer because we no longer have a packet set up for us. But ever since Formfast, I mean, they've actually realized that it's a lot easier now. All they do is, as you know, we have it set up. We also have McKesson. We have Paragon, though. And we have it set up to where all they do is print a face sheet and to the Formfast printers, and everything is printing for them automatically. Believe it or not, they're loving it. They love it now. I know at first, like I said, they were hesitant that it was going to take longer, but it's been easier, faster, and I guess the main thing, the most important thing is a lot less mistakes. Before we were getting forms being mislabeled with a wrong patient label and wrong signature, obviously, but now everything, you know, there's more accuracy as far as the forms that are being given to the patient.
Thanks, Maggie. Leslie, I don't know if you can remember not using Formfast, but can you kind of describe what life was like before Formfast and then how we've changed your life?
Well, when I was initially putting my answer together, I thought that we were talking about the actual design of the forms, and so the introduction of form imprint has really changed how we do our business here in Fraser Health from that perspective, because we had a number of different areas all doing different things in order to build forms and introduce forms at their sites. And so since we've introduced Formfast or form imprint, we've managed to standardize and create one form design and one form approval process so that now all clinical forms have to route through this one process. And so you can imagine for 14 acute care facilities, that's it's streamlining things quite a bit, and it's helping us move toward more standardized forms, even though that's not necessarily our mandate. That's kind of the end result because everything's flowing through one process now. I think it's actually cleaned things up quite considerably for us as well, because we don't now have people just building forms on their desktops and introducing those at their sites, because we're doing this in conjunction with a Meditech scanning software, and so now the forms that have to be scanned do have to come through our group of staff so that we can make sure they're built correctly in a standard fashion with the appropriate barcodes. So yeah, I'd say a significant change just in terms of cleaning that process up.
Thanks, Leslie. And just a reminder to everybody out there in the audience, this is an open forum, so if you have questions, feel free to post it up to the chat monitor, and we'll pose those questions to the group. Or if you have relevant comments on the topic, you can also use the chat or the QA screen to give your input on these topics as well. So I'm going to continue on with the same question over to Jason Youngvar. What's the typical forms workflow before Formfast, and how were the forms managed and implemented and stored? And again, just how long have you been using Formfast, and how has that changed your hospital's processes and workflows? Jason?
Sure. Basically, when I first got involved in the project, Formfast was brought on as about a project that we were getting ready to implement with some scanning software. We had decided at the time to use Valco data systems for our scanning as moving forward to our electronic medical record, and it was really twofold in the choice to move to Formfast. When I got involved, we were still using embosser cards, which I'm sure all of you all are familiar with. They had become fairly costly to maintain, and we seemed to have quite a few breakdowns with the embosser machines that created the cards. So when we went with Formfast, it was our plan to get rid of all the embosser cards, which was done. All of our forms up to that point had been pre-printed forms, either done by Standard Register or some of the other form companies around. We created some of the forms in-house, but basically, we had a small warehouse that contained all the blank forms, and they would follow the patient around with the little patient card, and they would all be embossed at all the workstations, or at all the nursing stations. Since the implementation of Formfast, now they're getting the labels in the admission packets. They're getting the wristbands when they come through the door, so there's no more chasing an embosser card around and leaving it stuck to the medical record. The users in our facility have the ability to reprint additional sheets of labels if what they're getting in the admission pack isn't enough. They have the ability to reprint wristbands. And because we're probably about 90% fully online documentation with Meditech, we've eliminated a tremendous amount of forms in that process. So we end up with, I've probably got 20 or 30 forms left that we actually have maintained the hard copy of the forms for, and we just stick labels on them now. The users here at our facilities have been very receptive to anything that would have gotten rid of the embosser cards, and they just love the wristbands and the whole peel and stick label idea for the few documents that we don't have pre-printed with all the user information already.
All right, thanks, Jason. Now, same question for Carolyn. Describe the typical forms workflow before Formfast, and how were forms designed and managed, implemented, and stored before, and what's the after effect of adding Formfast into your situation?
Well, before Formfast, of course, it was such a manual process. Most of our forms were clinical forms, which were designed by the end user, and they would use Word or Excel or whatever was available, and then they would send all the forms to the form committee to review and ensure that they meet the standard, and of course they wouldn't, because everybody had their own way of doing it, and so then they would have to go back and forth several times to be approved. Once they were approved, of course, they made copies of them, and then they were used on the specific nursing units. We also kept a master copy of all the forms once they were approved as well. At that time, we had an on-site printing shop which copied the forms and printed hundreds of copies and distributed to the nursing units. We found that we often had duplicate forms, as each nursing unit had their own variation for the same form, maybe just a little bit different. And we also had problems ensuring that the latest version of the forms were used, and older copies of the forms, we weren't sure that those were being destroyed. Since Formfast, we have a full-time person that designs and manages all the clinical forms, and certainly this is a very tedious job, and it takes a very special and detailed person to work with us all day long. She does a fabulous job. We no longer have the forms committee as she checks to be sure that they meet the standard before they're ever moved to live, and we've converted over thousands, I'm sure over 1,000 forms to Formfast, and have set up separate trees or categories for the different facilities. And let's see, form imprint is accessed. We access it from Citrix, so each nursing station can search and print for whatever form that they need at that time. This ensures that we have the latest version of the forms, and it reduces a lot of waste as we no longer have to keep these stocks of forms in this printing shop. We have done away with the printing shop, and as we no longer need that, so that saved us some money there. And let's see, we've also implemented the automation of some clinical forms that those are forms that are required on the patient's chart. So we capture the orders, send it over to Formfast, and then print that on the unit. So that's a great improvement. And then with the admission forms, of course, we have the forms, the face sheets, the labels, wristbands, and all of those, which some of the forms are printed, some of them are routed straight to HPF and a cold feed. So it's much, much improved.
Could I ask a question of you? Now that your forms are being printed from Form Imprint and they're all white, are you experiencing any difficulties or any pushback with that? Presumably your print shop was printing some forms that had colored components to them.
There were some different color forms before we went live, but now that it's all white, no pushback. I think it's a buy-in for management to say that it's still going to be the same form. It's still going to have the same form number. It's just going to be printed on the white paper rather than on the color paper. So no, we've not had any problems with that.
Thank you. This is Leslie.
This is Maggie. When we did have a pushback on that, as far as doctors complaining that their order forms were used to be pink and now they're white. And the way it was approached by administration was if there's not a compliance issue, if compliance is fine that they're white, then pretty much we're going to have to deal with it. I did bring up I did ask, okay, it's fine. I mean, as far as I'm concerned, to me it doesn't matter. We print a white or pink or yellow. But as a nurse, do the nurses want to be sticking in different colors of papers to print the colors that they need? But we also had those complaints.
This is Leslie Kaminsky again. This has been sort of our biggest challenge, I think, with the introduction of Form Imprint in all of these sites, is we're getting a lot of pushback from our physicians in particular, and so we've actually tried to assist this process and the change management by introducing new, more definitive binder tabs. That's one of the strategies that we've used. But other than that, we really haven't come up with anything else that is helping us with this transition. And I was hoping somebody would have some great suggestions for me today, because that is one of the pushbacks we're getting. I think generally people really like and enjoy using this application across our multiple installed sites, but the physicians are feeling that a little bit. So, is anybody else?
How long have you been on Form Imprint?
Well, we've been live since 2007, but but we're rolling out, as I mentioned, we're in 9 facilities. So in 2007, we brought our first site live, and just last week we completed one of the large 500-bed facilities. So it's been just a gradual rolling out process.
I think Clara had a comment on that as well.
We have a few customers who have in the past put on their form in that print job designer as it's printed out. They could put pink in the bottom right corner, yellow in the bottom right corner, and it's put on as a literal. Then I have other customers in the design who are putting on an indicator, whether it be initials or a a rectangle filled with a certain type of pattern that indicates what color it would be. You have to, there's a learning process, and the nurses and whomever need to get used to what that means. But it can be done either in Print Job Designer or in the design before it's printed. If you're doing it in the designer, it would then need to be 3 different designs printed with 3 different indicators. I'm just using that word. But if you do it in Print Job Designer, you can put a literal on that. So there's different ways to go around that, as well as I guess you could. There's also ways to order the different colored paper because it's in a ream and it's pink, yellow, white, whatever, and then you print it out 3 times. But so there's different answers to that question.
We've actually really been trying to avoid the colored paper, like loading our printers with colored paper, because we find that on the scanning end that we don't like scanning the colored paper as much as black and white. And so that's why we're really trying to stick to the white paper and avoid use of color if we can. And that's why we've been investigating all kinds of strategies to assist with just the black and white forms. But yes, so the symbols that you described, we've trialed some of that as well.
Yeah, I think avoiding the colored paper would be preferred. So there are other options with the symbols at the bottom. So
right. Thank you.
One of the things that Carolyn touched on was, eliminating the whole the print department and some of the benefits that they've seen. So I'm just going to go around the table again and see. I'll just pose this question out for some discussion. What's the biggest benefit you've gained from using Formfast products? And we'll start with Maggie. I know that Maggie probably is the newest customer here, but just in the short term, what are you seeing? What are the potentials that you're seeing?
Accuracy, as I mentioned, one thing is a lot less mistakes. Shorter registration process. Again, at first everyone thought it was going to take longer. In fact, it's getting faster. Let's see, what else? I think standardization. I know they mentioned this earlier as far as all the forms being standard. I know with us before, and that's something I did mention with your previous question, was before everyone was making changes to the forms at least 10 times a day. I mean, of course, it wasn't me making the changes, but because what we do, we have a third-party company printing our pre-printed forms, and it costs an arm and a leg to print, to have them do it for us, and that's one thing we're eliminating as well. But before, directors, nurses, whoever, they were making changes. And now with Formfast and me, I guess, because I complained, I said, hey, wait a minute, these are way too many changes. We need to put a stop to this. So that kind of helped. Now administration said, okay, that's good. We're going to make changes once a year. So all directors, they kind of didn't like it. But now they only have one chance. Look at the form, add everything you want on it, take out whatever you don't want, because you're only going to have one chance a year to do it. So I would say, the fact that we have Formfast now, that it's made things a lot easier for our compliance department, who are the ones who handle the forms. As far as, what's on it, regulatory issues. Of course, it's me doing everything with Formfast right now, but it's brought a lot of standardization, making registration a lot smoother and a lot of accuracy on the forms. And they look very neat. That's another thing, too.
Legibility, readability, yeah. So on to Leslie, the same question. What's the biggest benefit you've gained after using Formfast products?
Well, I'd have to say that it's the standardization and the just cleaning up of the process, because here in Fraser Health, we've got probably between 3,000 and 3,500 forms live so far, 3,500. And so in the process of collecting and bringing all of these facilities live, we've cleaned out such a lot of duplicate forms and really old forms that were being used that should not have been. The whole version control issue when somebody introduces a new form, but the old form is still out there being used. We've addressed and cleaned up a lot of that, so that I think that's our biggest benefit. And of course, then now we've got the reduction in that wasted paper that our print shops were generating. We still do use print shop because we still have lots of forms that even though they're in form imprint, we need to make them available in physician offices and that sort of thing too. So our print shop assists there. But it's the cleanup and the standardization of that process so that everybody understands it's no longer the wild, wild west in terms of developing forms in Fraser Health.
Thanks, Leslie. Just one little bit of housekeeping I have to do here. Susan Lebeau is on the line trying to dial in, and I just want to give her a quick instruction. We don't see a phone next to your name, so what we need you to do is dial in again. You go to the communicate menu at the top left of your screen, click join teleconference. It'll give you the dial-in number, the meeting number, and your personal identifier. And that personal identifier is what allows us to give you a phone line. So if you can do that, we can get you. Oh, there you are. All right. Okay, so just real quick, Susan, are you there?
Yeah, I'm here.
Great. Can you just introduce yourself real quick, and then we'll just roll you into the forum.
Sure, yes. My name is Susan Lebeau. I'm a systems analyst here at Beverly Hospital in Montebello, California. We're a nonprofit organization. We're a 223-bed hospital, and we have Meditech. In November, at the same time that we went live with the Focus 6.0 for Meditech, we implemented Formfast, Form Imprint, and we went with also the barcoding with the wristbands. So we had a lot of stuff going on then. We implemented this in about, from the time that we started training to the time we went live, it was 4 months. And we are now, like I said, live for the last 7 months.
Well, thank you. Welcome, Susan.
Thank you.
Jason, I'm going to pop back to the question, and if you can speak to Shore's Health benefits that they've gained from using Formfast products?
Sure. We've essentially eliminated our print shop. We, like a lot of the other panelists had mentioned, had so many issues with forms being generated by different departments from Word or from Excel or any type of document creation system within the units. Around the time that we implemented Formfast, we got real serious again with our forms committee and ensured that we ended up, being the single source for all forms that were generated, and going through the Formfast product that allowed us to eliminate having to destroy a lot of old forms that were on the floor. One of the other big advantages we gained from it was in the registration workflow, because we were able to build workflows on there based on patient type of registration. So really the registrar didn't have to think which forms they needed to be sent up to the unit with. We used Formfast to determine what their pre-printed packet of forms is going to be. Depending on if it were an inpatient or an outpatient, or an inpatient going to a tele unit, or an inpatient going to ICU would get a different set of forms, or even someone going to labor and delivery. It also helped with the onset of the Medicare letters that we're required to have all Medicare patients sign now. We were able to build that additional part into the logic so that if it saw that they had Medicare as an insurance, then it would automatically print the Medicare letter in the initial patient packet, so that the registrar would just know that they needed to get the patient to sign the Medicare letter too. It basically eased up some thinking that some people had to do, and our registration process here is getting more and more complex as they're adding, different systems in to audit the registrars. And registration that used to be a relatively simple job is becoming a more and more complex job. So anywhere we can use advantages of Formfast to lessen the burden on the registrars, everybody's really positive about the outcomes that we've had there.
Jason, thank you. Carolyn, can you kind of speak to the benefits that Centra's realized after using Formfast?
Well, I agree with the others. I think the standardization is a big benefit. We now have better control of the forms to ensure that the same version of the forms are being used throughout. Also, the reduced paper, since we do cold feed some of the forms over to HPF and stores them there. Also, just being able to print the correct form when it's needed and not having to store a lot of these forms on the unit and making sure that they always have the right form. I think it's a lot faster for them as well, as when they need a form, they can go to Form Imprint, search for it, and print the form that they need at that time without having to search through their drawers or wherever they used to store the forms to find them. But standardization is a big, big plus.
Carolyn, thank you. Susan, can we hear from you after your conversion, what kind of benefits you've seen?
Sure. Well, first I'd like to just reiterate with Maggie what she had to say, with it also being the data being accurate and the ease of transferring that data to the forms, and then also what Carolyn said about the standardization. But one thing that we were using it for was putting that Aztec barcode on our patient wristbands for specimens so we can scan them at the bedside. And so that's been a really big change for us, and we've just thrilled about. So I just like to, add that.
And that is a big plus. We use that as well, having the barcode on there, and they'll scan the patient before they do the glucose test or before they give them a med to be sure that they've got the right patient, as well as for tracking and cost. So I agree with that.
I also intend to do BMV within the next year, so you need it for that. Also, this is Jim Morrow. I'm the CIO here at Beverly. And with Formfast, actually, it's one of the many pieces of our overall strategy we've implemented in the last 3 years. Because we were a magic site that converted to 6.0 in November, and our intent is within 2 years to be 100% electronic, paperless, and eliminate printed forms and paper everywhere we possibly can. And so we, as part of our implementation strategy and conversion over to 6.0, needed a partner and a tool that we knew that everything that wasn't in the system we could get into the system somehow, and that's where we picked Formfast for. So we're kind of early in using it as far as a form generator, but it's part of our strategy that it'll fill all the gaps for everything that isn't generated by our system.
Yeah, we were pretty impressed with the amount of forms that Fraser has submitted already. That's really awesome. We currently only have about 36 forms. And that's going to be in phase 2 to start adding the rest of our forms.
Well, here in Fraser, we're not as far along with the actual electronic documentation in Meditech as we would like to be. We still consider this to be a bridging strategy so that as we bring different Meditech modules live with the electronic documentation, then of course we'd be able to phase some of these forms out. But it's such a large implementation and such a large group of hospitals that we're working with that it's sort of, we almost need to finish the full rollout and then go back and start again with some of these other strategies and implementations. It's hard to stop midstream with half of our facilities live and go back and start introducing other applications and new systems. So it's a challenge with an organization this size, for sure.
Oh, yeah.
It's hard. As part of our strategy is to say, okay, as we start this whole thing, let's get all the pieces in place, and then we'll build them all from scratch rather than switch over to 6.0, then start adding things and go back and redo. So that's why we were fortunate to get into this early with Formfast. And they hadn't done their system in a 6.0 environment before. So it's different. So they partnered with us to make sure that it would work in this new technology of Meditech, and it works just fine.
Oh, yeah.
So it's a tool we put in place to be used heavily over the next several years. And it's a lot. It's going to be an interesting process. Yeah. Our goal is to get electronic. I don't know. 80% will do.
Kudos to Clara, who worked with us. She, was just wonderful, and Dave Porter also on the server side. So I really think Formfast has a great support group there. and they've helped us a lot. And we really appreciated all their help.
Well, thank you for all that, and welcome, Jim Morrow, to the conversation. Thank you for joining us as well. I'm going to go ahead and jump into the next question here. I know we've got a lot of great discussion going, and keep it going here. But so the next question I want to lead into is, what was your perception of how many forms you had before you started with Formfast? Then how many forms did you find that you were automating with Formfast, and how many were you, what type of forms were you automating and eliminating, and what's on the horizon as far as your use in that area? And I'll open that up. We'll start at the top with Maggie here. She's on the top of my list there. Okay,
we have between the 4 main facilities that we have about 1,200 forms. I would say about 1,100 of those definitely have to be in Formfast. Right now, we're in the process of implementing our EMR system. We are going with Cerner, and that's to go live in September. And I know by September, a lot of these forms are going to be not obsolete, but not needed, and not even in Formfast, because they will be available online. But even at that, we are going to use Formfast as a downtime for downtime. If by any chance, Cerner's ever down, we can just print the forms from Formfast. But even at that, I still have to design all 1,100 forms. So that's where I'm at right now. That's how many forms I have to do myself. Yes. And I'm taking it by facility. I'm done with 1 complete facility. It was 90 forms. I have all those live. And I'm about 430 forms into our biggest facility. And that one has 800 forms. So I'm halfway there for that 1 facility.
All right. Thank you, Maggie. So that leads us to a question that came in from the audience is, do we use a phased type of implementation by area or department? I think Maggie kind of answered that, but I'm going to go ahead and add that to our question. So the same question that I'm going to pose now to Leslie. How many forms did you think you had before you started with Formfast? How many do you know you have now, and how many are live? And how's your rollout process? Is it a phased approach, and where are you at in that process?
I actually have no idea how many forms we had before, because we collected forms from all of these 14 facilities, and there were so many. They were generated in so many different ways. We had some being printed at external print shops, some being generated in our own print shops, some being printed from local PCs, that it was just really hard to get a sense of how many were out there. And there have been, because we're organized in these 3 service delivery areas, each area had done some work toward introducing standardized forms. And so what we collected versus what was live was really difficult to get a handle on. So I don't know how many there were. We collected thousands, and to date, we've actually brought about 3,500 into our live system. We collected many more than that, but I'm not really sure whether all of those were still actively being used. That's one of the challenges, is that these units keep these forms hanging around for 15 years and haven't been using them for 10, but they're still sitting there. So I've just not been able to get a handle on that. But we know that we've got about 3,500 now, and we've got still 4 significant sized facilities to bring up as soon as we do our conversion in that area to client server. The question about, sorry, what was the last question that just got added? The process of rolling out. Okay.
Yeah, is it a phased approach? How are you taking those chunks, and is it by department? It sounds like facility. Just how are you going about that?
Right. When we bring a facility live, we've done it enough times now that we've kind of got a bit of a pattern established. And so we start in the emergency area, because our patients, the bulk of our patients come in through emergency. And so we build all of the forms, so the forms are all live before we bring the site up live. The forms are added to the live system, and we've done all of that work with the end users to make sure that the packs and the contents of each pack are what they need. And then we bring the facilities live based on emergency and the critical care areas first, and then the medical areas next, and then the surgical areas. And the actual rollout period changes based on the size of the site. The last site we did, which was over 500 beds. That took us a full 2 weeks to bring each area live, to bring the entire facility live, because it's hard to support when you bring an emergency department of that size live. Then you need lots of bodies to support that for the first few days. So you can't just start bringing other areas live, because you won't be able to, unless you've got unlimited support on the go live support team end of things, which we do not have. So a smaller facility could be brought live within a week probably, but we still follow that same pattern, starting in the emergent, the critical care areas, and then move on to the medical, surgical, maternity, and then the outpatient areas is kind of the approach we've taken.
Great answers. Jason Youngbar, how about the same question to you? How many forms did you think you had before you started the process? How many did you bring live? How many did you maybe eliminate? And what types of forms are they? And then, what's the timeline, and how do you bite off that project to make it happen?
Well, when we started, we were probably in the neighborhood of about 1,200 forms that were used throughout different areas and different disciplines in the hospital. Some of them very unique, some of them not used very often. We put together basically a committee that was going to determine, from a registration standpoint, what type of patients got what type of forms all the time. And from that, because we didn't have really an FTE that was designated to support this project, because I implemented it, I ended up supporting it, and still to this day, 7 years ago, I still support it. We decided to implement the forms that were most used and common for most all patients, which, of course, was your face sheet, your physician orders, your nurse's notes, your I&O sheets, some of your standard ones. Some forms we initially wanted to do, we weren't able to do because of the nature of the form itself. We used to use a nursing database that was basically a trifold form, and we could never figure out how we were going to replace that with a standard form. But we did manage to eliminate a lot of the multi-part forms, and also we eliminated all the color type forms. We rolled this out through both hospitals, more or less with the Big Bang Theory, because, once we had decided to eliminate the embosser cards, we needed labels chasing these patients around so we could put it on their documentation. So it took us about a week and a half to bring the two hospitals up. Luckily, Karen Paul was on site with us for most of that, so she made everything much easier for us. But in respect to the forms situation at this point, because we are up and have been up with, the electronic medical record and online documentation for about 5 years now, we're up with bedside medication verification, and we've just gone up with physician order management. Each phase is requiring less and less pieces of paper as more of it's going to online documentation. So I can tell you at this point, probably my registration packet is much smaller than it was when we first started.
Thanks, Jason. Carolyn, can you kind of speak to Centra as far as how many forms you have in place there, and then maybe kind of what kind of forms you have live, and then how you handled your rollout of the different departments?
Sure. I don't have an exact count of the forms, but I know it's way over 1,000 forms. Most of our forms are still clinical forms, and I hear a lot of talk about the other sites going paperless, and that's pretty exciting and it sounds like we've got a ways to go because we're still pretty much paper here, but we're trying to get away from it. But we do have the clinical forms. We do have the admission forms and patient receipts and detailed statements. We print some of those from Formfast as well. When we first went live, we did do the bulk of our forms at that point. So we hired temp employees to come in and help us design the forms from like a Word document and bring them into Formfast. And so we had a big rollout at that point. And then since then, we have added on a couple of additional facilities. And, you know, certainly their number of forms is not as many. So we have added those and kind of phased those in as well. But ours was more like just a big bang theory when we first went live with it. It was a lot of work, but, you know, when we look back, it was certainly, we got a lot accomplished. Brad King was our installer, and he certainly was a great help and, you know, continues to help us whenever we need him. So I think that was part of it, him just helping us get started and going in the right direction.
Carolyn, thank you very much. And then I'll throw this over to Jim and Susan then, as far as Beverly. How many forms do you have in place now? And can you say a little bit about how you did the go live, how you rolled that out?
Well, gosh, there was just such a big project going on. Well, no, we did have the 6.0 that we were more concerned about at the time, converting from Magic to 6.0, and doing this all at the same time. Again, there was me as the lead on it, and then we had the medical records director who was involved because she's on the forms committee, and then one full-time admission clerk who we would pull her from her job, and she was kind of the one that would help us with getting these forms in. So between the three of us, we did all of our 36 forms. We were contracted with Formfast for 25 admission forms and 30 clinical surfaces. So we went ahead and wanted to at least get that done since that wasn't going to be our concentration yet. Like I said, it was going to be in phase 2. So we did the admission forms. We did a lot of the more, what I call the difficult forms, we had Formfast do because they were from our breast center. There's a lot of images from the wound care center and from our women's care center. Their forms had a lot of data on it, a lot of images, and so we went ahead and did all of those first. And it was a difficult process, you know, but again, I think when we roll it out, I'm not sure how many forms we have. I tried to get that number before this meeting, but wasn't able to get that. So I'm not sure, but we're only a 200-bed hospital, so I'm hoping we don't have thousands. I think it might be under 1,000 forms. I know we'll probably do it by department is what I think it sounds like is the best way to roll this out. I know I was over in the special care, the ICU unit, and I know they have tons of forms. They handed me, 4-inch thick pack of forms that they have. So because sometimes forms get outdated, it sounds like the best way would be to do it by department. That way we keep it organized and we know we have the most current form and no one's going to be making changes on us. And plus we are trying to get more people on the forms committee and get that more organized so nobody's making changes on us in the middle of things. So if we have one person that is in that forms committee who is on this project, then I think that will help keep us more organized and have the most accurate and current data. So, so it sounds like it's going to be a lot of fun when we don't have a lot of people. There's all kinds of projects always going on, and we just do what we can with what we have. I'm just, like I said, I'm just thankful that we're a smaller hospital, and sounds like we would have probably had to hire people or temps like the other people did in order to get this done, because it's pretty big. But yeah, we did it all at the same time, just rolled it out, everything at one time. And because there wasn't that much to begin with. So, you know, it was not as difficult as it sounds like some of the other people had. Not as much difficulty.
I also have to say, in the spirit of making it fun and interesting, at the same time we did a whole new dictation system we went live with, same time, which had a huge impact on medical records. We also switched our OR systems. We implemented the ED systems. We completely redesigned all of nursing documentation, which is supported a lot by the forms. And we're currently, now that we've been live with nursing for 6 months, we're redesigning a lot of areas within nursing now that we know the module really, really well. So there's going to be a lot of changes within nursing. And we're in phase 2 is bringing on full CPOE. So there'll be a lot of form support as we get to physicians, both in the ER as well as in-house involved. So, you know, we try to do everything at all at once.
Or just do that way.
Thanks, Jim and Susan. I wanted to, Yvonne Rubenstein, she's one of our newest users with Formfast with Community Hospitals in Ventura, California. And she's got an incredible suggestion here that I've not heard before. She said she's having a lot of success with a contest to collect all the unused or out-of-date forms, and then each verified form is worth a meal ticket to the submitter, and the department with the most submitted forms get the party. So people that are, you know, a lot of the times in the beginning of the project, it's kind of a struggle, as Jim and Susan indicated, that a lot of your nurses, you know, will put forms in drawers, you know, as safekeeping, and it's really hard to get all the old forms out of use because everybody has their own private backup copies. That is probably one of the most incredible suggestions I've heard. I mean, I hope that well, we're gonna steal that from you, Yvonne, and put that into some tips and tricks. That's incredible. Thank you.
We also have a question coming from the audience, Judy Spillers, who was on our forum yesterday. She wants to bring up the idea about the job tree in Form Imprint, and what scheme do you use to organize the job tree, and how many jobs do you have, and do you allow departments to design their own job tree area, or do you have some specific policies related to that job tree? Leslie, I'm going to ask you, you've got a pretty big implementation. That's probably an issue that you deal with.
Yes, it is. And as we bring each site live, we get it. There are more and more challenges because we started with a structure that we felt we wanted to sort of develop a basic pattern so that staff that move from one facility to another, because we have lots of staff that work at multiple facilities, they would be able to recognize the contents and the structure of the job tree no matter what facility they were working at, because we've set this up as one job set so that you can see the entire tree for all of the facilities from whatever site you're at. And so we developed a basic pattern. We had a users group, and we had input from a lot of different clinical people in the initial stages of our project. And then we just work with each area as we bring them live. We allow them to customize the basic pattern, but we enforce the basic structure, and it's generated and structured based on services. Like we'd have a category that is emergency department, and a category that's medical, and that's psychiatry and obstetrics. It's a general basic structure like that, a surgical heading, and then each grouping of forms that appears under that heading, we then allow each individual facility to have a lot of input into what types of packs they want, because the workflow is different in each facility. So we've been so busy rolling out, we haven't actually built standards that define this, but we have a small work team, and so we have a good sense of what the pattern is and what kinds of areas we will allow flexibility and what areas we try to maintain the basic pattern. I don't know if that explains that well, but it's hard because every facility thinks that their needs are different, and we're different here because we do this, and that's why we need to change everything and have it different for us. And so our challenge is keeping our end users happy with the flexibility of the system, but yet maintaining a structure that makes sense so that people can move from organization to organization and still find the forms they need.
So just for another input on that, I'm going to go over to Carolyn from Central Health, who has tons of forms, large facility. How do you go about rolling out your job tree? What do you have a structure, a program, a policy around that? How does that work at Centra, Carolyn?
Well, on our tree, we have like a top 20 form or a top 20 category, and under that are the forms that are used most often, so that it makes it easy for the nursing units to find what they're looking for. Then we have them, and they're by departments, and kind of like the other hospital, that they can kind of define what they want in a packet under their part of the tree, or what forms they need. And then down at the bottom, we have all forms, so they're just in alphabetical order. So some forms are used only on a specific department, so they would certainly go under their department, but they would go down, you know, under all forms as well. We also have separate, I guess, trees for each facility, for the main facility, so that the forms that are unique to that facility are only under their own facility. The central facility, we certainly have a lot more forms than we do for our smaller LTAC facility.
Carolyn, could I just ask a point of clarification? It's Leslie from Fraser Health. When you say that you have got multiple facilities, when you're sitting in, do those facilities all appear under one job set, or have you got separate job sets for each facility?
We do have separate job sets. Like we have a Centra facility which has its job set, and then we have the LTAC, it has its own job set, and then we have another facility, Southside, that has a separate job set.
Thank you.
Thank you. Based on kind of what your experience, so I'm throwing this out to the panel, your experience with trying to get up to go live, can you, and managed services is a relatively new product offering we've had in the last year and a half. If you could have taken advantage of form design services, would it have been beneficial? And I'll just throw that out. Actually, Jason, let me throw that to you.
It may have been. We had talked about it back when we were doing the implementation, and Formfast was a little smaller than it is now, and that was one of the options that we could have paid a custom for. But where we knew we were going with that we were going to be not too long before we went with online documentation from the implementation of Formfast, we decided to deal with the 50 or 60 most used forms that we had in-house, and together through some of the training with Formfast and the implementation, we knocked out about 10 or 15 of those, and then I was able to squeeze the rest of them in between times. But being not a huge hospital system and not that reliant on so many forms, that would probably be a better question for like Leslie, who's got a huge pile of hospitals there.
So what do you think, Leslie, if this had been available earlier when you were rolling out a full service model where we not only did form designs, but even after the fact of form design, just the full maintenance of it, would that have appealed? Would that have helped you out?
Well, excuse me, we did actually contract out the design of our forms from you. Because we had so many forms in the beginning and we had a small project staff. There was myself as the client lead. I had one system application coordinator and a project manager, and we had to work with the technical team to set the system up and build all of these forms. So we contracted the form design piece out to Formfast, and then once we get into maintenance phase, then we take over. And because we're just continually rolling out and bringing on more and more hospitals, we've not been able to get our staffing level up to meet the needs of building all the new forms. So yes, that's essentially what we've done. But I think that we want to maintain, once sites are live, we'd like the ability for our staff now to maintain the system and design forms after the go lives when we're in maintenance phase.
Great, and you had mentioned earlier how fast you were able to get these sites online, and I suppose our Formfast services played a little role in that to help you get them online.
Well, yes, because we've got such our project structure is defined well in advance, which sites will go live at which time, and with the size of our project team, we recognized that there's no way we could do all of that work of building the forms, supporting the site through go live, and getting the next forms ready for the next site. So we've done the form collection well in advance, and then we start sending batches, and we have a process worked out with the staff at Formfast where we just send batches of 50 or 100 surfaces. They design and bring them back in-house, and all the time that that's happening, we're out working with the site. Once we've received all of the forms and brought them into the form imprint system, then we start designing the job tree with input from the site. And so we have to have the forms kind of done in advance. And yes, that was key, that without enough staff of our own to do that, we've had to use the Formfast, and we would not have been able to have the success that we've had without that service, I don't think.
Thanks, Leslie. So the next question I'm going to take over to Susan. And it's about going green. So this trend of going green and eliminating paper. Do you have any measures or any idea of what environmental impact you're seeing from eliminating pre-printed forms and the disposal of obsolete forms, maybe through Formfast? What kind of impact you might be having in the going green kind of idea?
Impact as far as our facility? Or the environmental impact?
The environmental impact that, no longer throwing out obsolete forms, but rather going to on-demand system, things like that.
Well, it's California, and all the forms paper we save throwing away, we replace with IOUs from the state government. So I'm not sure we're making any ground on green. California has become a very interesting place financially the last couple of years. But yeah, we've had an environmental impact, but it's really, to be honest with you, not one of our initiatives. We're more into a survival mode to be able to be a hospital, still be here in 5 years in California.
Right. So there's a lot of talk in the industry about going paperless, and so. Is that driven more by the fact that you want to get to EMRs, or Yeah,
it's driven really by patient safety, by efficiency of service, by better patient outcomes. We know that having an electronic EMR is certainly a better EMR than a paper one, and as quickly as we can get there, the better off we'll be. We also know that when we can get our entire medical record into a data format, we can store it and back it up and have disaster recovery anywhere. I mean, California has earthquake problems. California has fire problems, and anything you have that isn't duplicated someplace else that you can access within an hour or so is going to make it very difficult for you to ever have the ability to sustain yourself in a disaster. I mean, if you have physical charts that, given an earthquake problem, you can't get to, but you can get the patients out, and you can, take them to someplace. Well, how are you going to treat them if you don't know what you were doing? So, it overall, just for daily operations, for efficiency, for cost management, for better patient outcomes, and for disaster, we have to go electronic. That's really where Formfast fits in with our strategy. That's what's driving our decision making here.
Right. Thanks, Jim. So over to from California over to Texas, Maggie. What do you feel about the going green and how Formfast has worked in that area?
Well, I'm not, compliance is the department that takes care of the old forms, and like I mentioned earlier, before they used to make changes every day, if possible. Departments could have maybe 3-4 packages for the pre-printed forms that they had to now get rid of because the new form came in. So I'm not sure what compliance does with the old paper, but then again, I mean, I know, we're killing a lot of trees, and now with Formfast, we don't have to worry about that anymore. Not at all. So they only print what they need, and we don't have to worry about wasting paper. So I'm sure it's a good environmental impact that we're doing right now.
Thanks, Maggie. And Leslie, I'm sure you can, with all the forms that Fraser has, you can speak well to the environmental impact that Formfast is having on Fraser. And Leslie, I do want to ask you, you'd mentioned the impact that eliminating the addressograph card has had. Can you speak to that?
Well, yes, because with all of the facilities, as we move in with Forms on Demand, we introduce label printing instead of addressograph cards. And so that's been one of the significant environmental factors that we consider, is that we're no longer having to generate that plastic. And it, strangely enough, whenever the word green comes up in relation to Formfast, that's what our end users think about, is the fact that now they felt really uncomfortable with that plastic card and how to dispose of it after the patient had left the building. So the fact that we don't generate those plastic anymore, that's just a plus in terms of environment. And of course, we've realized, I don't have any measurables on how much paper we have eliminated either, because it was just so hard for us to get a sense of what was out there when we started. But what we do know is that we're no longer ordering large supplies and stocking them in our back rooms. So the end users on the nursing units are ordering more paper so that they can print the forms as they require, but it's still, they're only printing what they need. We also feel, though, that we're not quite there in terms of the green thing. So we're not using this whole initiative as a green initiative, because we are still entirely, or for the most part, paper-based documentation, but then we're scanning on the back end after the patient leaves and discarding the paper. So somehow that still feels like we've got some work to do before we can consider this a green initiative, because we're still using all this paper and then discarding it at the back end. So the plastic was a big bonus, though, eliminating that.
Thank you, Leslie. And then to just have a comment or a question from John Tanner, actually from Washington Healthcare. He wants to throw out a panelist question: how you handled NCR or multi-copy forms? For example, order sheets with multiple copies to nurses. I'll just throw that on the table. Can you all speak to that, kind of how you've addressed that? Maybe getting away from the NCR and doing just multiple copy papers, or?
Well, I can speak for in Fraser Health. We basically did a business review up front to identify what forms were NCR multi-copy and determined whether we could convert those forms to forms on demand, or Formfast. And where possible, that's what we've done, is just eliminated the NCR component, because we found that a lot of the NCR forms in use, it's just been a historical thing. They've done that forever, and they actually might not even be using the copies. It was some of the physician orders where that copy was being used, so we made sure that everybody has the ability to order, enter, and fax orders to the pharmacy. And as long as they have that ability, then we eliminated the NCR forms there. And we've retained some NCR forms because there were some areas where we just couldn't replace the functionality efficiently. So we've had to maintain a few of them.
We appreciate that feedback. Carolyn, with all the forms that Centra has, can you speak to that issue? Have you encountered that, or?
Well, I know that we did have some NCR forms before go live, and I think we as well converted those to just forms where they would print, if they needed 2 copies or whatever, it would just go ahead and print the 2 copies. We did use some NCR paper as far as in the admission packet. I know we had that at one time, but I don't believe that we're even using that anymore. But you can buy NCR paper to where it would print, 2 copies, and then, of course, it would carry through when you write on it. So.
Caroline, it's Leslie in Fraser Health. When you did that, what form was it for? Was it the admission form, or was it the emergency record? Or
it may have been the emergency record, because it wasn't the admission form, but I don't even believe that we're doing that one anymore.
Do you have any sense of why they might have stopped? Because we're actually trying to look at a way to eliminate that multi-copy form here in Fraser Health, and have thought about Formfast and the NCR paper in our laser printers, but I'd like some idea of whether that was successful or not.
Well, we recently replaced our ED system. We've got a new one now. It's Allscripts, and a lot of the forms and things that came out of the admission packet for the ED now come out of Allscripts. So if they're doing the NCR paper now, it's coming out of that system rather than coming out of Formfast. So I can't really say exactly what replaced it, but I know we're no longer using the NCR.
Thank you.
So we have another question from Dennis Heller in the audience, and we've talked a lot about. One of the questions that I posed earlier was how many forms did you have before starting with Formfast, and how many you have now? And I know it's a mystery sometimes how many you actually had before, because you're just going in and trying to get a system up and running without worrying about the forms that didn't matter. So Dennis is asking, did any of you do a return on investment type of justification before implementing Formfast solutions? I'll go over to Jim and Susan first to see if they did anything like that, and then anybody else that wants to comment on that in the panel can go.
No, we didn't do that at Beverly. I mean, that wasn't the point of doing Formfast. We didn't do it as an economic benefit. We did it as part of our overall strategy. So, in fact, it really didn't matter what the return on investment was, because it was really the overall project that we're looking at. To be honest with you.
Yeah, right. And Maggie, do you know if there was an ROI done at Doctors? Doctors runs a little bit differently than a lot of hospitals. They're a little more business driven.
Very different. Yes, we did, and since we have, we have this third-party company doing our pre-printed forms, we needed to justify that we would be saving a lot of money by getting Formfast instead of paying them to do our forms. So yes, we did have an ROI.
Thanks, Maggie. And just because Doctors is a little bit different the way that it runs, one of the questions here is that many customers feel that physicians' satisfaction is a high priority, and I would imagine so at Doctors Renaissance.
Yes,
what are the tangible ways that you found to keep your doctors happy there, and how has Formfast played a role in that?
We've we're fairly new. We started implementing in November. The print on demand has, it pretty much started in February. I think I got it going around that time. I'm not fully done yet, but so far so good. I mean, they're happy. The only complaint that I've had is what we talked about earlier was the color paper, and the administration approached it as, okay, if this is only because you want it, I'm sorry, if you're, or it's more of, okay, your nurses don't have an issue putting in pink paper and then taking it out to print the rest, or whatever the case may be, because of different printers that may be throughout the whole hospital. Where, go ahead, it's your call type of thing, but they're happy. I mean, they haven't complained at all. No, they haven't. Honestly, that's about the only complaint I've had from physicians, which was just the color paper. That is it. So they're so far so good.
Awesome. Well, yeah, good.
Yes, that is good.
Jason,
well, you know what? I will add. I'm sorry. I will add something too on the NCRs. Okay, I'll take it back. Another complaint that I had was the NCRs, and because of that, we have not gotten rid of all the NCRs. We did also do an assessment as far as, okay, what do we need as an NCR, and we did find also that some carbon copies were not being used. Medical records ends up getting both copies at the end instead of just the one that they're supposed to. So we are getting rid of the ones that we can. And for example, at the anesthesia forms, those they don't want us to touch because, anesthesiologists are not part of the, whatever the case may be, they're afraid that a copy's not going to be made, charges are going to be lost, and so on and so forth. So NCR was another hot topic for as far as physicians is concerned.
Thanks, Maggie. Jason, can you kind of tell us a little bit about how Formfast is keeping your doctors happy? And
actually, I don't know in our facility, since the majority of what the doctors are dealing with now is online. It certainly improved the flow of documentation to the doctors, but pretty much all of our doctors have gotten used to looking at the electronic medical record online. So they've, as far as being paperless and green, we've come a long way in the last 7 years to the point that we're probably 90% of all of our information is online. And still 10% left in paper, which is ultimately scanned and put online as it is. But we did have doctors are a little little challenge to deal with in respect of changing NCR from them. We did have some forms that were NCR. The doctors couldn't justify why they needed them, and no one else could, so we have managed to get away from them. The only other issue we had in dealing with the doctors, there was one special form, and I don't remember exactly now which form it was, but it had to have something to stand out on it. So I just basically took that form in Design Manager and created a large black block at the bottom of the page so that when they were flipping through a paper chart, when it was still a paper chart, that particular document would stand out. But, you know, as far as I can remember in the last 7 years, that's probably the only issue we've had on the physician satisfaction side of the house, you know, in having to make a change to be accommodating to them.
Okay, so then on the other side of it, keeping physicians happy is one part of the deal, but the other side of it is Joint Commission surveys. So I'm going to start with Jason on this. Describe your last Joint Commission survey and what effects does accreditation have on the decisions that you make as far as technology or using Formfast in different ways or things like that? And has Formfast helped you in some way in accreditation in that process, Jason?
Well, I think one of the biggest helps Formfast does for us is allows us to track better all the documentation within the hospital through the use of barcoding. All of our documentation is scanned, and barcoding makes it ultimately much, much easier to deal with from a scanning standpoint of view. And not just for Joint Commission, but for RAC audits and for audits that we do, you know, from the University of Maryland and from KPMG and the many auditors that come through here. Having the documentation online now, as a result of having everything barcoded and easily scannable, makes the whole audit process much easier. Joint Commission just loves our online documentation and our ability to better track and provide a safer environment with less manual writing of anything within our facility as far as trying to write account numbers or medical record numbers on documents, because everything is now labeled or pre-printed, and then there's no transposition issues because the barcoding, you know, allows everything to be automatically read and indexed when the documents are scanned in. So for all the other issues we may have for Joint Commission, they seem to be very happy with the state of our electronic documentation and forms processing.
Thanks, Jason. And so, Carolyn, how about you at Centra and your Joint Commission survey, the effects that maybe Formfast has had on that, and your decisions in how to roll out technology? How does accreditation affect that?
Well, I can't really speak on the Joint Commission or the accreditation. The only thing I ever hear is when we hear Joint Commission's coming, and then we hear, okay, everything went well, and they're gone. So I have no idea. I'm not involved in that area.
No news is good news.
I think so.
So that brings up a question for me personally. How does this work in Canada, Fraser Health? So, Leslie, what kind of accreditation do you deal with there? Leslie, you there?
Sorry, I was muted. Sorry, I was muted. Things are quite different here in Fraser Health in Canada, essentially, with our accreditation process. And we're much like Caroline now. We just hear that the accreditors are coming, and then we hear they're gone, and we're not involved at all in that process anymore. So, because we're not being accredited at the site level, it's on an authority basis. So.
And aren't you glad you're not? It's like, yay, they're gone. It's like, I hope they don't ask me anything.
Susan, I want to ask you, what's the scariest part about the accreditation process? Can you speak to that, what Beverly's experience has been?
No, we've done well at accreditation. We actually did the Joint Commission just as we were implementing the new system, so we did it pre-Formfast. We know overall that the more electronic and the more live we become, the better we'll do for Joint Commission. I would say the scariest thing to me has always been twofold. I've dealt with it both on the lab side as well as the IS side. Is number one, requirements that they come up with late that require you to do a great deal of work to be able to satisfy, for the sheer purpose of satisfying Joint Commission, has nothing whatsoever to do with the operation of your hospital. And two, the amount of time people use Joint Commission as an excuse to not do IT-related projects. That, to me, has been one of the biggest impacts of Joint Commission I've seen over 30 years. People say, well, no, we have to join commissions, we can't do that. So, to me, that's been a big impact. Great excuse.
Thank you, Jim. So, Maggie, I'm going to pick on you for a minute. Can you tell us what are initiatives like RAC audits? Is that a point of concern at your hospital?
Yes, it is. Yeah, I mean, I'm sure you and many others are well aware of what's going on with the RAC audit. Well, as far as Joint Commission and so on and so forth, again, you know, I can't really speak much in that area. I'm not too familiar with it. And a RAC audit is a big deal. And, you know, right now we've had 2 so far this year, and we're doing it through FastFlow, which has turned out really, really well. And I know our departments are the departments involved for the RAC audit are very well pleased, and we're just kind of sitting back right now waiting for the next one.
Thanks, Maggie. For those that may be unfamiliar, can you give a description of what RAC is, and for those who may not realize or?
Okay, yeah, again, I'll just talk to you based on what I've learned from being involved with the RAC audit. I'm not too into details familiar with it, but it is Medicare, I think. Yeah, it's Medicare who, the RAC audit, what it is on a monthly basis. It's supposed to be on a monthly basis. Again, we haven't had one for the past 2 months, I think. They send a letter requesting up to, I think it's 80 medical records. They could request up to, I'm sorry, not medical records, 80 visits. And what they expect is they expect the medical records scanned. I think now it's supposed to be scanned in an electronic file, electronic format. And what we do is we send the whole medical record, and they're just looking for, I guess, discrepancies and making sure that we weren't overpaid. I doubt that they want to know if they underpaid us, but they want to make sure they didn't overpay us, and if they did, I'm assuming we would have to pay them back. Again, I'm not too familiar with the real details of the RAC audit, but I'm very familiar with the RAC process now since we're doing it in FastFlow. But it's a Medicare audit.
Do you use FastFlow just to track it, like what you've sent out, or how do you use that?
No, it's used for the whole process. It's from the starting point, the minute we get the letter from Connolly. Connolly is I'm assuming the audit company who sent the letter to us. The letter is it's already in the FastFlow process. We fill out we have a form that is filled out, and it's pretty much the whole process. We scan in the medical records. Since we're not in EMR yet, we physically have to scan the medical record or the chart. We upload it to the FastFlow, and it routes itself to the different departments that have to go in there and make sure everything is everything is there needed the way it's supposed to be. Okay. So it's like I said, it's turned out very well.
Okay.
Thanks, Maggie. So I'm panning for compliments here, but I mean, how would you have handled RAC without Formfast at this point?
Everything would have, the way it's been done before, manual. When the letter comes in, the letter is sent to medical records, and medical records have to look for all the charts, whether we have them in-house or in the warehouse. They get the medical records together, and they start passing it along departments. And it's all by hand. It was all manual. Now it's all on the computer.
Thanks, Maggie. We're really proud of our product at Doctors Renaissance and the RAC application that we have going there. Do you have an idea of the volume, how many requests you've had since you've taken it live?
We've had, is it 2 or 3? Lynn, I want to say it's 2, right?
I think we're at 2 right now, yeah?
Correct, yes.
And that's the ones that have been challenged. But as far as requests for records, were there more than that?
No. I mean, for as far as RAC audits, we've had 2 RAC audits. The first audit was 21 records, 21 charts that they were requesting. The second one was 30.
Okay.
Yeah. And it goes a lot faster, that's for sure. I mean, the scanning part of it, since we're not an EMR right now, that's what takes a little bit longer. But once all the charts are scanned and uploaded to the FastFlow, the actual process of it going from departments to departments for the review process, and it goes a lot faster. And it's really neat because at the end you export your batch, you burn it onto a CD, and you're done. You send it over.
Great. Thanks for all that, Maggie. One thing that we've been talking about, and kind of our change in our direction here at Formfast, has been about really enabling hospitals to become a high-performance hospital. And that may mean business performance, that may mean better patient care and outcomes, that may mean a variety of things. So I'd like to ask each of the panelists what that really means to them, and I'll start with Jim and Susan on describing what a high-performance hospital might mean to them.
Well, in truth, the high-performance hospital is really not one of our goals as such. We assume that it will be a byproduct of everything else we're doing. In being a standalone independent hospital in Southern California, our main goal is to survive the economic crisis, to survive California, to survive all the changes in healthcare and IT and technology, and earthquake retrofitting, which is a huge project here in California that only we face, and to get through all of this alive as a hospital. And we think we have the strategy to do it. And if we are excellent as a result, that would be great. But survival is first for us, because a lot of hospitals around here haven't. To be honest with you, it's a little bit of a different environment.
Yeah, right. Everybody's got a different set of environments around them. So I'll go up to Carolyn at Centra. What was your idea of the high-performance hospital be, or what are you shooting for? Where are you trying to become?
Well, as far as what the high-performance hospital, what it meant to me was having the latest technology, software, systems, whatever, to ensure that we have the best tools available to aid in performing test and documentation, tracking the patient's progress. Also, that includes educating and training the employees to ensure that they're proficient in using the software, and then automating the manual processes whenever possible. But we don't want to become so high-tech that we lose the close contact and the care of the patient, because I think sometimes with all of these clinical systems that the nurses, they're so involved now in entering in data that sometimes I think they lose the close contact with the patient. So we want to be high-tech, but we want to keep that hands-on care as well.
So to do that, are you looking at mobile devices or even smaller, like even Blackberries or iPhones or iPads or tablet PCs to kind of bridge that and be able to be high-tech but still have less barrier between you and the patient?
I believe that they are. We have the carts now where they can roll around to the patient's room so that they can capture the data as they're there, but sometimes it seems a little impersonal when, the nurse is just standing there entering in data without really actually looking at the patients, and I'm just saying that from a personal experience when my husband was in the hospital. So, but yeah, they are looking at doing some things like that, and anything like that I think would be great to help us to become more high-tech.
Great. Thanks. And lastly, what does the high-performance hospital mean to you, and what is it that you're working towards at Fraser?
Well, excuse me. We're always looking to provide high quality care. That's our and patient safety is always a big driver for everything we do. But we want to be as efficient as we can as well. And so with tools like Formfast and our Meditech scanning, we're looking to provide efficiencies in document management and reducing storage costs for paper records and all of that kind of thing. And so we're moving in that direction as quickly as we can, but here in Canada, I feel, or in BC particularly, we feel sometimes like we're a little bit challenged to keep up technologically because we don't have a lot of the technology that you're talking about or even enough PCs to make some of these applications work efficiently. So that's from my perspective, that's my goal, and that would be my wish, would be that we could sort of bring everybody up to a level that makes our people's work efficient, but still able to provide that high quality of care with that interpersonal touch that you've talked about already.
Thanks, Leslie. And Maggie, at Doctors at Renaissance, what would the definition of the high performance hospital be for you guys?
I would say customer service. I mean, obviously also providing the best, healthcare, using the best technology. I know they're very driven with customer service and providing the best we can provide. And what we're trying to do here is trying to, provide everything that a patient may need here in the Valley or the Rio Grande Valley instead of having to travel to San Antonio or Houston or Corpus to get, treatment that maybe other hospitals around the valley may not have. And that's what they strive for. They try to provide everything that the patient may need here, close to home as opposed to having to travel. And again, customer service is a big one here in our hospital.
Thanks, Maggie. I'm going to throw this one over to Susan and Jim from Beverly. So here's a new question for you. If you had unlimited money and resources in the perfect world, how would you improve performance at your hospital? What would Beverly do?
In actual fact, we'd do exactly what we're doing. The only difference is we do it with probably a lot more resources and people. But actually, the plan we're doing is the right thing, with or without ARA, I think, with or without any government mandates. We're really focused on going to a very patient safety, clinically driven system that is the best. And it just so happens that it happens to fit well with everyone else. It was our plan 5 years ago to do this, before everything else came up. So we're actually doing what we would want to do. We'd probably just do it a lot faster with a lot more people.
That's good. Good to hear the positive, Jim. Thank you. Carolyn, so for Centra, if you all had unlimited money and resources, how would you improve performance at your hospital?
Well, this is strictly personal. This is my preference here. I kind of agree with Jim that, to hire more IT resources to implement and support the systems and to provide the education and the cross-training, not only to provide it, but to allocate the time and resources needed, to get that cross-training. Because I think we, as well as everyone else, you're so fast-paced now that you don't have the time to really learn something or really be proficient at it before you have to move along and do something else. So I think it's just hiring more resources.
Thanks, Carolyn. You gave me some low-hanging fruit there, and I'm going to take it. That's as far as managed services, and I would like to remind everybody of our managed services, and that's where we could really fit some of the bills there. Leslie, can you let us know what Fraser, what resources and if they unlimited resources and money, how you all would improve?
Well, I had similar thoughts to the previous panelists, but I think we're moving in the right direction because we're working toward providing a really patient safety and high quality patient-oriented systems here. But I think that we could always, it's the IT challenges and it's hard to keep up with the growth that we've got. And so if I had unlimited resources, it would be adding them in the IT area and the education and the support pieces, because like the other panelists, I think there's always room for improvement there.
Thank you. And then Maggie, Doctors Renaissance, if you had unlimited money and resources, what would you all do?
Personally, and this is just me, hire like 10 people to help me with Formfast. Because I am the only one doing the designing, the implementation, the rolling out, the everything. So, but yeah, I agree with everyone else. You know, I think we're pretty much doing what we want to do. We grow so fast; it's unbelievable how fast this hospital is growing. But it doesn't seem like we're falling behind in anything. It's just yes, if we could get more people in IT like everyone else, you know, is saying, I would agree with them. You know, more resources to help educate, training, and so on and so forth. Same thing here.
Raises all around, right?
Raises all around.
Yeah, that too.
One resource that we don't have any more of is time, because we have another great presentation series starting up at 1:30, and it's 1:30 now. So I'd like to thank our panelists, Maggie and Leslie, Jason, Carolyn, and Susan and Jim. Thanks. This was a great session, interacting with one another, and our audience was great. We really appreciate that. And also, if you like this panel discussion, we'd like to carry this through to our Formfast Users Forum, and that's found at formfastusers.com. It's about a year old, and so we'd really like to allow a format or a forum for all of our customers to go in and have these types of discussions together, and you know, share best practices and be able to engage and understand there are people out there that are doing the same things in different ways, and kind of share that information. So if you're not a member of the user group, we encourage you to go over to formfastusers.com and sign up and be active, be involved. It's your forum. Once again, thanks to our panelists and thanks to the audience for all the great questions. And I'm going to turn it over to Laura.
Thanks, Sean.